إن الله وملائكته يصلون على النبي يا أيها الذين آمنوا صلوا عليه وسلموا تسليما. اللهم صل على محمد وآل محمد. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. ليس البر أن تولوا وجوهكم قبل المشرق والمغرب ولكن البر من آمن بالله واليوم الآخر والملائكة والكتاب والنبيين وآتى المال على حبه ذوي القربى واليتامى والمساكين وابن السبيل والسائلين وفي الرقاب وأقام الصلاة وآتى الزكاة والموفون بعهدهم إذا عاهدوا والصابرين في البأساء والضراء وحين البأس أولئك الذين صدقوا وأولئك هم المتقون. الله أكبر الله أكبر الله أكبر. بسم الله الرحمن الرحيم. بسم الله الرحمن الرحيم. لإيلاف قريش إيلاف فيهم رحلة الشتاء والصيف فليعبدوا رب هذا البيت الذي أطعمهم من جوع وآمنهم من خوف. صدق الله العلي العظيم. اللهم صل على محمد وآل محمد. اللهم اشف مرضانا، اللهم اشف مرضانا، وخاصا مرضانا المنذورين بشفاعة القرآن. اللهم اشف مرضانا المصابين بفيروس كورونا بشفاعة القرآن، إنك على كل شيء قدير برحمتك يا أرحم الراحمين. آمين يا رب العالمين.
أعوذ بالله من الشيطان اللعين الرجيم. بسم الله الرحمن الرحيم. Dear respected viewers across the globe, Assalamu alaikum jami'an wa rahmatullahi wa barakatuh. We come to you at a very dire time and very important time in our world, one where we are seeing numerous nations with different scenarios. On one side, we have a scenario where we have certain nations which are getting vaccinated and they are moving towards progress with this global pandemic that we are facing, such as those as the United Kingdom and the United States and other nations, where you see people getting vaccinated and many people are hugging their loved ones. But in the same world, at the same time, we are seeing a parallel scenario where we have countries such as India, which are suffering extensively during this time, where you see scenarios of loved ones carrying their deceased, where we're seeing people striving and trying to get oxygen. We're seeing people who are trying to get some type of cure for the ailments that their loved ones are suffering. This is happening at the same time in the same world. We've come here and we've gathered here to discuss and try to understand what is it that we can do in order to make this the best possible scenario and how we can benefit society at large. Therefore, we've gathered a number of panelists as well as our respected scholar, Sheikh Nuru, to discuss this as well as panelists. I would like to first welcome our panelists on board. First, Sheikh Nuru, who needs no introduction. Assalamu alaikum, Sheikhana.
Wa alaikum assalam wa rahmatullah, Sayyidina. Thank you so much for inviting us.
Thank you for joining us. We really appreciate it. Also, along with us in the Lucknow region of India is Sayyid Najm al-Hassan Rizvi, Sayyid Najmi, who has been working with TMT extensively, building and carrying on the work of around Dr. Qalb Sadiq Saab, who needs no introduction. Sayyid Najmi, thank you so much for being with us.
Assalamu alaikum, everyone. Thank you very much, Brother Shabir, for hosting this session. Thank you very much.
Thank you. Thank you so much. Then coming to, of course, Dr. Shaukat Ali Mirza, who is in the Hyderabad region of India, who's been working extensively to try to curb this situation and help with many other endeavors in that region. Assalamu alaikum, Dr. Shaukat. Thank you for joining us.
Thanks a lot for giving me an opportunity to join this webinar.
Thank you. And also, of course, last but most certainly not least, Brother Ali Akbar Sharaf, who's been working extensively in the Maharashtra, Gujarat regions, and several regions of India, has joined us to detail us on what is going on the ground in Maharashtra as well as in Gujarat and some other regions of India. Assalamu alaikum, Brother Ali Akbar. Thank you for joining us.
Assalamu alaikum warahmatullahi wabarakatuh. Thank you to have me on this show. Thank you.
Thank you all for joining. I just want to get straight into it and just try to understand what is the ground reality and get a picture of what's going on the ground in India. If I can come to Sid Najmul Hassan on this. Sid Najmul Hassan has been working in not only Lucknow, but Uttar Pradesh, one of the largest provinces and states in India, and has a pulse of what's going on in this region. Sid Najmi, if you could please give us an indication of what's going on the ground in UP in India, so our audience can better understand the scenario.
Actually, I think in the second leg of COVID-19, everyone has been caught in India by surprise. First of all, everyone was not prepared. While they were coming out of the first phase of COVID-19, they were covering up the collateral damages, what was created by then, but they were not very proactive in preparing, or rather they were not had conceived that this is going to come in such a big way. So all logistically as well as medically, no one was prepared for it. They were on their way towards giving vaccinations, but again, the mindset of the people in general, there was still a lot of, I would say, dogmatism involved in this, that people were still debating that whether to go for vaccination or not to go for vaccination. And while this all was going on, we were hit badly by the second leg of COVID, which we were not expecting. So taken by surprise, things went very bad. Like hospitals, they didn't have capacity to accommodate the patients. Within the scenario, within the hospitals, there was shortage of oxygen. So as a result, things went out of control. And still, government as well as social bodies, they are trying to work hand in hand in order to control the situation. But looking at the population size, and mainly the population which is educated, they are not aware how to handle this situation, in particular this disease. It is all over the place. So basically, moving forward, what has been done, we should not discuss and not waste our time, but we should focus ourselves at two levels. One, how to minimize the damage right now upfront, as to relieve the sufferings of the people, and as to do the best possible what we could do for the COVID infected patients. Second thing is this: moving forward, we have got a lesson to learn from this, that we should not become complacent, and we should be all prepared, but rather we should prepare ourselves in a better way to counter this disease in case it comes with a more force in the third leg, which some people are talking about, that it's going to be more aggressive than what we are seeing right now. So without wasting time, we should prepare for that. So right now, for the short term, right now what we need to do, since the hospitals are running at full capacity, they cannot accommodate people. So we have to do it at a home management level. Now, when it comes to the home management, we can divide this into two levels. One is preemptive measures. Sorry?
Go ahead, we can hear you. Please continue.
Okay. Right now, we can divide the preemptive measures, like we have those who have not been infected, they should take precaution. All precautions should be taken. All safety measures should be taken. Even people get carried away politically as well as religiously to crowd up together and to increase the risk of spreading the infection. We should try to control this as much as possible. Secondly, we should try to take all vaccinations wherever they are available, whenever they are available. The third thing is this: lot of medicine is available in terms of our building up our immunity system, like prescribed by the doctors. Under the supervision of the doctors, we should go for them. Those supplements, as well as some herbal supplements also available, we should go for them so that our immunity systems get built up. Over and above, we should take steam at least twice daily to keep our lungs clear and clean. So these are some preventive measures we should be adopted, whether we have been inflicted by it or we have not been inflicted by it. For those who have been inflicted, we should not go and handle those patients on hearsay method, because a lot of information is floating around on WhatsApp and everyone is becoming a doctor. So my first advice would be to whatever they undertake, they should do under the supervision of a medical expert. The consultation should be put in place. We have tried to put consultation whenever we come across any case. We first of all try to put them across to a doctor so that they get a perfect consultation, because a lot of panic is also there. Need not necessary that if someone is suffering from common cold or maybe from a cough, he has COVID. But the fear element is so high that even a slight sneeze triggers a panic within the family that is a COVID thing, and they start doing all sort of cures which are floating around with the WhatsApp. So A is this: we should not move forward without a confirmatory test under the supervision of the doctor. And once the doctor has advised on the regime of medication, that should be followed. Now, again, if a family can afford it, well and good, then the social system, social organization should come forward to support those people who cannot afford the medication. The essential part of, see, oxygen in this case is like a medicine. If you overdo with it, then it is also wrong. If you underdo it, then it's also wrong. So people, again, the greed is there, the fear element is there. People who are rich, who can afford, they are stocking oxygen in their homes. And with the slightest breathlessness, even if, and each one have got these oximeters within their home, and as soon as it sinks to 94, 95, they put themselves on oxygen, which is not correct. So we should be responsible. We should be, I should start thinking rationally and under the supervision of the doctor, because right now we should not be our doctor on our own, but whatever steps we take, we should take in consultation with the doctor, even the usage of oxygen. The same thing applies here. Like social organizations like ours, we are trying to reach out to people in need of oxygen, but again under supervision as much as we can, so that this is like a medicine and it can save people. Other than this, there are certain other measures which need to be adapted. Like before oxygen, nebulization is very necessary. Again, by consultation of the doctor, if the doctor advises, nebulization has also helped a lot of patients to come out of the situation, and they have improved. Their breathlessness has improved and the situation is improved. So basically, by doing this, we will put a lot of load less on our hospitals, which are working. A lot of doctors, they themselves have been compromised, unfortunately, and still these bodies, are operating and they are taking things forward. So we have to reduce the load of the hospitals by taking due precautions as much as we can to adapt some preemptive measures, as well as try to strengthen the home management system, so that the patients who are in the early stage get managed properly within their home care by proper guidance of the medical consultant. So
Thank you.
this is a bit of thing, though the scenario in the news everywhere, what we see, it's a true picture what is happening around. Lot of damage is there, what we are seeing right now. And other than that, beyond this, lot of collateral damage which has been caused is going to surface in due course of time. And we have to focus ourselves toward that. Also, people have been abandoned. The families have been abandoned. The head of the families has gone. There are children who, even the father and the mother both have gone, and the children are there who need to be taken care of down the line. The families have to be taken care of down the line. So these are the long-term things. The basic thing is this: we should just pray to Allah to forgive us for our uh, deeds, whatever wrong we have done, and we should pray that moving forward, God should give us strength, and people should come together and work in a right direction, and we should stop wasting our time in just doing humor mongering, blame game. What has been done, it has been done, but we should learn from the lessons and move forward positively, so that we are able to control the situation as much as we can and prepare ourselves for the next leg, God forbidden, if it comes. With this, I would again stop here and would like to hear the other panelists on the board. Thank you.
Thank you, Dr. Syed Najmi. Thank you so much for that. As I turn to Dr. Shaukat on this, we've been hearing this narrative of, and there are these phenomenons of these different types of variants, the different variants that are emerging of the virus, the UK variant, South African variant, and other variants. And as we have more variants, this causes more challenges. So as this virus spreads more in India, it has an impact on India, but globally, because those variations can spread globally. Dr. Shaukat, can you give us a little bit of an understanding of what's going on the ground there in Hyderabad and the different provinces in your vicinity? And so our audience can get an understanding of that. And so we're going to try to keep this as succinct as possible, so we can also get the view of Brother Ali Shroff as well as our respected Sheikh Nuru. Dr. Mirza, if you could please give us some guidance on what you're seeing on the ground, please.
Thank you, Shabir. Thanks a lot. Situation in Hyderabad, it looks a bit better when I read about Maharashtra, UP, and other states of India. But looking behind, it looks every day we are adding more and more numbers to the new cases and to the death toll. That creates a lot of fear in the minds of general public, even in the minds of the frontline workers and volunteers. Our situation in Hyderabad is much different from what Najmi Bhai is having in Lucknow or Mohsin Dharamsi in Bhavnagar, that they have a facility which they can control to their best possible efforts. Unfortunately, there is no such facility in Hyderabad. And Helping Hands, since last 8 years, 9 years, we are in the forefront as education service provider, something like that. We used to mentor, guide towards education, job placement, skill development, vocational training. That was our main platform. But since last maybe 12 to 14 months, since the breakdown of the first wave of COVID, we entered to some extent into this arena. As Najmi Bhai said rightly, yes, probably by January, February, we thought that we have defeated Corona. We came out happily. Schools were reopened, the colleges, academic activities, malls and cinema theaters. Everything was in a normal fashion, as if the life has come back to normal. And all of a sudden, once again, we started seeing this thing. If Brother Najmi can say that they were unprepared, imagine the situation where there is no such facility in Hyderabad at the community level which can provide even the primary services to the community members who are suffering from either COVID-19 directly, or they have entered into a situation where it might not be COVID, but because of loss of jobs or no income, less income, they are suffering from various diseases, including sugar, thyroid, BP, cholesterol, and not able to manage their medication. Helping Hands tried to some extent to put their foot down to cater the medical aspect of the Hyderabadis, but the situation, what has come in the last maybe 15, 20 days, I can say in Hyderabad, not a single hospital is available to take any patient right now. God forbidden, if I have to go to a hospital right now, there is no place in any hospital, including the one where I have personal, very strong connectivity. Also, there is no place. That has created a lot of fear that if Shaukat Mirza cannot manage to have a bed for himself, who is having lots of connections with multiple organizations, hospitals, and people, imagine somebody lesser in social status, how they will be able to manage that. That was the reason that in the last 8 to 10 days, we were actively discussing with the trustees, advisors of Helping Hands to put one foot forward to see what best we can do. But I think we are too late in coming forward. I don't know, things are getting worse day by day. Things are not available at all. Forget about supporting for the bed in a hospital. We are not in a position even to get an injection. We are not in a position to get a oxygen concentrator. We are not able to get a doctor online. That is the situation. We have very good doctors with our team, but unfortunately, they are not in a position even to pick up our phone. That is the situation has come. So we might get in touch with those doctors who might have maybe retired from the services and available, might not be having full-time exposure to what is going on in the world, in the city. Really means I can say that whenever I used to talk to my team, I used to say that if you have a problem, you also come with a proposed solution. I might accept, I might not accept. But today I am standing with a problem, but I don't have a solution with me. I am literally seeing patients. They are waiting in the hospital, hoping that somebody else will die so that they will get the bed. I'm sorry. So that really creates a lot of fear, uncertainty, and as I said, yes, I'm standing at a platform with a problem, but I don't know what I have to do. And I take it as my personal social responsibility, because as of now, in Hyderabad, at least Helping Hands is the forefront social organization trying its best to take cater maximum number of beneficiaries on all types of beneficiaries, whether it is social, economical, educational, financial, all types of cases we are taking up. But I don't have a solution to think as on date, what can I do to provide any minimum possible help to the COVID patients. The one more thing which is adding to the fear is the asymptomatic patients are almost 80% in number as compared to the symptomatic patients. That means nobody knows when you move in the market, when you move outside your house, to what extent you are getting mixed. Unfortunately, in Hyderabad, still social religious gatherings are going on. People are gathering in multiple numbers. There is no sense, no sense of understanding, to believe that these mass gatherings have to have a control of that. I don't know whether I can put partial, fully responsibility on the so-called religious scholars, ulamas, and zakir to refuse to address a majlis in person. But still, every day, multiple gatherings are going on in the community, in the city. Thanks, Shabir. I'm still here. Would like to listen to other speakers.
Thanks.
Sorry that I got emotional.
Thank you so much. May Allah bless you, Dr. Mirza, for everything that you're doing on the ground there. And I think it's a moment for us all to pause as humanity and reflect how dire the situation is, where people are actually waiting for others to pass away just so they can have a place to get some treatment. It's a very dire situation. It's a moment for us all to pause and humanity. As I come to Brother Ali Akbar Shraf to kind of give some ideas, we've also gotten some questions from the floor here from our audience who's actually been watching and asking about, how can we help on the ground? So Brother Ali Akbar, if you could please tell us what's going on in Maharashtra and Gujarat and the regions you've been helping in, and what can people do to help out in this situation?
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم السلام على الحسين وعلى علي بن الحسين وعلى أولاد الحسين وعلى أصحاب الحسين وعلى محمد وآل محمد صلوات. So, Brother Shabir and respected Sheikh Noor, I will just come directly to the point. As my learned other panelists have already spoken about the other conditions, but I'll speak about the ground reality. So, the ground reality right now in India is like, previously it was death. Death was coming as a news. I mean, if I was also hearing, we would have said, Inna lillahi wa inna ilaihi raji'un and pray for the departed soul. But today, actually, people and our Mu'minin Shias have come face to face with death. Now is the situation where they are actually losing near and dear ones, and what death comes, how death comes, and what is the pain to lose a dear family member is come to us. I just talk about a small village in Gujarat where you have about 30 Shia families in Vijaypuri. You will be surprised to know that 27 out of 30 have been infected with COVID. If I talk about a place like Mawa, where you have a large number of Shia population, that is in Gujarat, okay, as we speak today, yesterday's figure were 28 mayats happened in one single day. In only in Mawa, I'm talking about, not the whole district or not the whole city, but I'm just talking about a small town like Mawa, where these figures have come up. So the situation is as bad as that in Taraja, in Rajula, in Mumbai, in other parts of Vidarbha, that is Nagpur, Nasik, Barora, Hinganghat, everywhere the situation is that bad. And the main cause of the problem is that, as my other panelists did say, that, we were caught unaware. Now that's where the situation is vulnerable, and that's what we need to tackle. Now, a lot of time has been wasted in knowing what the problem is, but how to tackle the problem. So I see that, oxygen concentrators, this is one of the items which is quite required. Maybe a 5-liter capacity or a 7-liter capacity or 10-liter capacity. Now, this is just to give you an idea of the ground reality, what's happening at this point of time. Now, an average cost of an oxygen concentrator machine in normal days would be somewhere around, 45,000. That is about pound 450 or pound 480. Today, after even having money, even after trying to procure, we are not able to procure it at about 750 pounds or maybe 850 pounds. Also, we are ready to pay, but we are unable to find those machines. A small thing like a oxygen cylinder, which is the biggest need of the hour right now, where we can treat the patients at home as well. A big machine, a big cylinder of oxygen would cost somewhere around, say, pound 140. Now today we are paying, as we speak right now, also we're paying about 230 pounds, 250 pounds per cylinder. And Dr. Shokit Mirza said, in fact, we have our Jamaat in Hyderabad. So Dr. Aslam is the president out there, and Mazhar Abbas is the secretary out there. Yesterday we've dispatched about 5 cylinders to Hyderabad as well. We've dispatched about 10 cylinders yesterday to Bangalore. Right now, we've again managed for another 10 cylinders today to be dispatched to Bangalore. And we have made, along with World Federation, we made a task force, okay, who's taking care about the whole of India in totality. And we're trying to reach out to maximum number of people that we can. Small example, again, oxygen flow meter. Oxygen flow meter in a normal day would cost around 6 pounds to 8 pounds. Today, we are paying about 35 to 40 pounds. And, the injections that we talk about, the remdesivir injections, normal cost would be around $40 pounds or so. Today, we are paying 270 pounds, 300 pounds, and we are not getting it. So that's the ground reality that we have. A small tablet, which has been used like a Fabiflu, okay, for maybe, treating cold and flu, that cost around £5 to £6. Today, even after going to 20-25 medical stores in a city like Bhavnagar, and we still cannot find it after paying £50 to £60. So that's the ground reality at this point of time. People are like just falling like a pack of cards, and it's too scary at this point of time for the entire Shia community and humanity at large. Thank you.
Wow. Thank you, Brother Ali Akbar Shah, for everything you do there and all that you've helped to facilitate it. The magnitude of the problem is quite massive, as we're hearing from our panelists. I want to come to Sheikh, respected Sheikh Nuru, who has been, has been involved with so many different communities, from with Indian community, African community, and others, and globally. And Sheikh Nuru, if you could please give us some guidance on what are our responsibilities from the Islamic perspective, as a community, as a society, locally, globally, in order to help society and help mankind and try to ease the suffering and the pain that people are going through. Respected Sheikh Nuru, please.
Ahsan, thank you so much, Said Shabir Kermani. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuhu, my dear brothers and sisters. And thanks to my co-panelists for sharing with us what is really happening in the ground. Thank you so much from the bottom of my heart. I think as Muslims, as human beings, and as lovers and followers of the Ahlul Bayt alayhim salam, we do have duties and responsibilities towards our fellow human beings. And these duties are deeply rooted and enshrined within the religion of Islam, in the glorious Quran, and the teachings of our beloved prophets and Ahlul Bayt alayhim salam. One beautiful tradition of our beloved Imam Amir al-Mu'mineen said, people are Allah's family, irrespective of their religious affiliations, irrespective of their backgrounds. They are Allah's families. And Amir al-Mu'mineen mentioned, the most dearest servant of Allah is the one who is able to empathize and sympathize with his fellow human beings. This is a call for duty, my dear brothers and sisters, that we should try as much as we can to reach out to our beloved brothers and sisters in India. The country is bleeding. The situation is not easy. And we cannot, under any circumstance, fold our arms and do nothing about it. We need to respond to this calling of Imam Amir al-Mu'mineen alayhi salam. Our beloved Prophet made it crystal clear that Wallahu fi awni al-abdi ma dama al-abdu fi awni akhih. Allah will continue to assist his servant so long as the servant continues to assist the servant of Allah tabaraka wa ta'ala. In one beautiful tradition, the Holy Prophet mentioned, Ar-Rahimuna yarhamuhum ar-Rahman, irhamu man fil ardi yarhamukum man fis sama. Those who are merciful, the most merciful will show mercy unto them. Then he said, show mercy to those who are on earth. The one in heaven will show mercy to you. Let us show love and mercy to our beloved brothers and sisters in India. Whatever is humanly possible from our end that we can help towards alleviating the sufferings and the pains of our beloved brothers and sisters, we need to do it. Remember, my dear brothers and sisters, we are all together in this. Like the way the Holy Prophet sallallahu alaihi wasallam mentioned, we are like the walls of a building. Like this part of the wall is strengthening the other, and the other part of the wall is strengthening this other part. Let us show love, I repeat again, to our beloved brothers and sisters in India. In one tradition which we all know, our beloved Prophet mentioned, La yu'minu ahdukum hatta yuhibba li akhihi ma yuhibbu li nafsi. Your iman or your faith will never and ever be established until and unless you love for your brother what you love for yourself, until you love for your sister what you love for yourself. We are human beings, and Amirul Mu'mineen alayhi salam said, people are of two kinds, isn't it? Either your brother in faith or your equals in humanity. In India, we do have a lot of our brothers in faith, and we do have a lot of our brothers in humanity. It is our duty, I repeat, and responsibility to reach out to them in whatever way possible. Remember, servitude to Allah is equal to servitude to humanity and vice versa. And our servitude to Allah will remain incomplete without servitude to humanity. And so therefore, we do have responsibilities. We do have roles towards these brothers and sisters. Let us try. Is it oxygen that you want to sponsor? Whatever that they are in need of it, let us all join our hands, my dear brothers and sisters, and support them. Supporting them simply means supporting ourselves. And supporting them simply means triggering Allah's mercy on us. And supporting them simply means implementing the teachings of Allah and the teachings of our beloved Prophet Muhammad sallallahu alayhi wa sallam. And so therefore, upon hearing from my co-panelists, now I've realized how dire the situation is. And we cannot fold our arms and do nothing about it. And thank you so much, Mainstay, for organizing this timely webinar. And I hope and pray this is the beginning of the conversation in trying to solicit the help and the funds on behalf of our beloved brothers and sisters in India. Thank you, Sayyidina.
Ahsan, Sheikh Noor, so eloquently put. As always, as in service to humanity is service to Allah subhanahu wa ta'ala. Building on that, as we're starting to race the clock and draw to a conclusion in our program, I just want to come very quickly to each of the panelists, starting with Brother Ali Akbar Sharaf, to just say, to answer those two points that have been raised by the respected Sheikh, and how we can bridge the gap with our audience. Well, what is needed on the ground there, and how can we help? How can our audiences that are watching this help? Who can they get this to? There are people who want to help, they just don't know how to. They don't know what's needed. They don't know how to get to the people on the ground there. What, if anything, can be done? Brother Ali Akbar Sharaf, if you just give us a succinct answer to that in terms of how can people help.
Thank you very much, Sheikh Noor, for words of wisdom, and Sheikh Sabir. Sheikh Sabir, right now, the ground reality, see, what I will say is, we discuss the solution rather than the problem. So, to make oxygen available to people, make oxygen concentrators available to people, that's our priority. Whereby, these cases can also be, the mild ones can also be treated at home. So that does not require a lot of hospitalization and all, because hospitalization is also like coming to very inflated bills. And our community in India is like, maybe 80% of the community is like, middle class or below middle class. 20% are the people who could take take the effects of this lockdown for a year and sustain themselves. But otherwise, those people who are in a majority, more than 75% of the population, are unable to sustain this years of lockdown and this treatment cost. So there is one aspect that we need to look at by comforting them for this, maybe food baskets on a regular basis, medicines for widows, and education for children, and prima facie, the most important right now is the cost covering of the medical, the things that are required, like the oxygen concentrators, the flow meters, the cylinders. These all things have to be provided. So that's one. And what I look at is, the community has phenomenally responded also to India. And let me be very honest, the mainstay is at the forefront. The World Federation is at forefront. Alhamdulillah, we've created a task force, as I mentioned before, and 60 oxygen concentrators are already been shipped by World Federation to India, which is soon going to be received in Gujarat. And inshallah, to all the places, including Hyderabad, Bangalore, Maharashtra, Gujarat, we're going to spread these oxygen concentrators. Locally also, we're trying to buy as many as we can. So this is 2-3 things that I look at where we should, financial support coming in at this hour will be most needed for the community at this point of time to come out of this situation, inshallah.
Can they reach you on the ground there directly? Can our viewers get in contact with you or your organization or anyone?
Absolutely, Sheikh Sabir. My number can be shared. I am not alone. I have a team of about 80 to 90 volunteers along with me. And see, this is the time where, the community is like, this is the beauty of our community. This is the beauty of our community. I'm telling you today, I'm blessed to have been born as a Shia. You will not believe it. Places where we are getting the help, the volunteers are coming forward. They're not even looking, otherwise they have their own mindsets and everything, but phenomenally, a small town like Morbi or a small town in UP, today we were speaking to people in Muzaffarabad. Okay, right now, just before I joined you, I got a call from Kodinar, and there was a Maulana who spoke to me and said that people require oxygen and alibi, people are dying out here. So immediately I connected to Haider Meghani from Gujarat, and I said that you can just call him. So before this in the evening, I just before after iftar, I got a call from Kandivali in Mumbai, where somebody required one oxygen concentrator. So I immediately contacted my team member and asked him, if your work is stuck up, you just let me know. During Mahi Ramadan, I actually keep awake in the night. In the morning, I'm sleeping till late. Sorry about that. But this morning, 9 o'clock, I got a call that the two patients were admitted in hospital and they required medicines. So one of my team members, I immediately called him and I said, I approved a budget of about 150 pounds for that patient. And I said, keep supplying medicines to them. So if you speak about any place in India, Alhamdulillah, wherever the Jamaats are there and the setup is there and the World Federation wings are spread, Alhamdulillah, we are reaching and we are there to reach. If you want, I can share my names of the volunteers and with their contact numbers and email IDs, where you can ask our panelists and our the population in India to talk to them, and we'll be happy to help.
Very good. We will try to share with the program details, inshallah, during and after the program with our audience, inshallah. So watch for us on social media, on Facebook, for example, and other social media outlets. We will, inshallah, share the details of the respected organizations here and perhaps others that you can help support on the ground there, inshallah. And you can, of course, contact info@themainstay.org.uk if you are interested. Inshallah, we can help liaison you and connect you with the respective organizations on the ground if you're interested in supporting. Dr. Shaukat Mirza, I know we're really racing the clock again, but if you could succinctly just tell us what is needed and how can people help who are watching this program, inshallah.
Blessed if somebody can provide a few oxygen concentrators. Thanks to Brother Shroff, I understand that it is available with Dr. Abbas, some source of oxygen, but we badly need, I think, oxygen concentrators. I am in touch with multiple people. People have promised me 2 days down the line, 1 week down the line, 10 days down the line. So far, I do not have anyone available with me. Cash is not a problem. Getting the oxygen concentrator is a problem. We tried to make a list of doctor panelists who should be available at least for immediate consultation. That is there. We have tried to stock up some preliminary medicines so that we don't have to rush from pharmacy to pharmacy to find something. This is minimal thing that we could offer. The frontline workers are following all norms, but I think oxygen concentrator is a major item that I look forward if we can get from any source at the earliest.
Inshallah. Inshallah. Thank you for that. Thank you. If you could absence on what you're noticing in Lucknow and what is needed and how can people help on the ground.
See, the situation in Lucknow is no less than what it is severe, very severe, I would say. Even in some of the cities in UP, like Aligarh, it is very bad, what we are seeing right now. So as I mentioned before, the hospitals are there. No one is ready to take any hospital beds are full, lack of oxygen is there. All these things, everyone of us knows about it. It is a news media, and it's very true that what the ground realities are. But what we need to do is we have to be very organized and try to work with the limited resources what we have. So it's a crisis management. In this crisis management, first of all, we have to see whatever is available, because resourcing itself is a huge problem. Like oxygen concentrators, procuring them. You have got money, people are there, organizations like yours is there, ready to help all of us. But unfortunately, the ground reality is this: the procurement is a bottleneck, the logistics is a bottleneck, the availability of the medicine is a bottleneck. So we have to circumvent and we have to find out a way. We have learned a couple of things, as I have mentioned, that some preemptive measures have to be taken place. So those who are not sick, they have to be controlled so that they don't become sick. Second stage is this, that who are sick, they are into categories. The severe ones, they have to be put into hospitals. There's a team we have created. We are trying 24/7 to adjust them into hospitals as much as we can. The serious ones who have just started into it, whose oxygen level is just sinking, it is around say 70, the management has to be there. There are a couple of exercises. See, the thing is the equipment will come. Again, if you get 100 concentrators, for example, it would be a great help to everyone, but the size of need is so huge. We have to take a combination, a mix, and we have to employ these concentrators, the oxygen, to those who really need it. So we have to put, our team is there, people are willing to work, alhamdulillah, that is a great sign. But at the same time, we have to plan ourselves, because see, the people, when they get panicky, even the person who is having a oxygen concentration of 92, they will also queue up for oxygen. So we have to plan ourselves a level best and try to do a crisis management with our resources are available with that. And as soon as we get the other resources like concentrators or supply of oxygen, essential medicine, then we can pull it up. So we have to work with whatever is available, and we have to ensure that whatever, how to minimize the damage what is being done right now. And second stage, as all of us are aware, is that yet we, something else has to come, that is a collateral damage in terms of education, livelihood. People are going to families are there without any heads there. So the second phase would be to take care of those issues which we are going to see in future. And the third and most important is this, that we have learned a lesson, and now onwards we should not just go sleeping as the things come down. It is going to peak off this phase, but eventually we have to continue working to do a lot of capacity building, so that in times of crisis we are not keep keeping off guard. We have ample amount of resources within our community centers, and we are able to put them in place right away. So that was the basic thing what we missed this time, because the first phase was not so alarming, and we didn't prepare ourselves for the second phase. And God forbidden if the third phase is going to be there, as people are talking, so we should start preparing ourselves as much as we can to do a lot of capacity building. And another important thing is this, lot of decentralization has to take place, that the communities, the pockets, they have to work independently on their own within the town. Even if there are parishes, there are areas that the people have to be put in place, and the central coordination committee has to look after those pockets, so that it is decentralized and the workload does not come onto a single person or single committee altogether. So a lot of decentralization and the resourcing at a local level has to be created, because we tried to get concentrators from Maharashtra. We did the order, and certainly we realized that the restriction is there, that the goods cannot go outside uh, states to another state. So those sort of logistic problems are also there, like things coming out of Delhi into UP. Against the restrictions are there in the border area. They say that the essential commodities like concentrators, oxygen, essential drugs, they have to go into Delhi first, and then they have to come into UP. So those sort of ground realities we are facing, so those have to be taken care of as well. So I would say that a lot of thanks and pray for all those who have been so proactively thinking outside to help us now and in future. And this is going to be a long-term thing. So let's pray and let's hold hands together, so that we try to manage and fight this situation out as much as possible. And Shaukat Bhai, let's get in touch offline, and we'll try to fix up some things. We'll try to assist you in something, so that out of whatever is available with you in Hyderabad, you can try to maximize the help and reach out to people as much as you can.
Thanks a lot,
Thank you
Tanvir
once
bhai. Thanks a
again,
lot. I'll be back to
Mainstay
you.
Foundation and Sheikh Noor, for giving such a beautiful sermon, motivating us, and for all the prayers that we need a lot. Thank you very much once again.
Thank you. Thank you so much. And as we close out the program, I'm just going to come to Sheikh Noor for just a dua and a prayer for all of us and for humanity at the end. And I just want to say what a beautiful time where we're seeing the camaraderie. And I will come to Brother Ali for in just a moment as he may have a statement. But to the camaraderie, the different organizations on the ground are coming together to help one another out. It is that type of time where we all need to together and band together. You may be seeing the information that's going across the bottom of your screen. You can get in touch with us. There are some great organizations that are doing some great work on the ground. World Federation, Zahra Trust, for example, Lady Fatima Trust. They are trying to do work, so you can reach out to them. If you need the contact, you can reach out to us via the email or the WhatsApp that is going across your screen, and we can help get you in connection with them, or of course our respective organizations that are gathered here, whether it's TNT, Helping Hands, or for example, Qasr Bag or World Federation, you can get in touch with them, inshallah. Brother Ali Akbar Shah, please go ahead. You may be muted. Can we hear Ali Akbar Bhai? Can you hear us? Can we hear you, sir?
Yeah, sorry. Yeah. So as we speak right now, thank you very much, Seth, for this opportunity. And Dr. Aslam, the president of Hyderabad Jamaat, inshallah, will be in touch with you. 2 oxygen concentrators are right now available with him. Okay, and he's a doctor himself, midst of treating the patients of COVID, inshallah. So let's have a better coordination between the 3 of us or the other panelists, inshallah, and we'll see that how we can make this difference to our community wherever it is required, inshallah. And one more thing, I'll just say, the global community, I see a lot of comments going on, how they can reach out to us. I think the best way of reaching out to us is TMT and WF, because I've been seeing that how Said Kirmani and how Said Hassan Al-Hakim has been disturbed with the flow of events that are going on day in, day out. I've been getting messages from them, calls from them, how we can reach you, how we can help you. And with this, I will also thank the global community highly. We are touched and we are in depth the way the global community has responded to this need of our, and the way people have reached out to us. Like small example, when we just rolled out a message in India and Mumbai to have some few oxygen concentrators, and speaking about say about 10 or 20 days back, we had this An-Nisa Foundation in Canada, who through their family resources in way back in Mumbai, they arranged to send us funds, say about 5 machines, and we could buy those 5 oxygen concentrator machines and reach out to the people who are in need. So thank you very much, the global community, and India is highly in depth to all the support that has come, and thanks to Said Hassan Al-Hakim, thanks to Said Firmani and TMT to have supported us in such a big way. Thank you very much. Jazakallah.
Thank you so much, Brother Ali Akbar Sharaf, and thank you, Dr. Shaukat. Thank you, Sayyid Najmi. We're going to conclude, inshallah. There's a lot to be said, but more importantly, there's a lot to be done. And all our panelists are very busy, as well as our respected scholars. They're trying to raise awareness. They're trying to solve this problem on the ground, and they've taken time away from their busy schedules in order to address this problem, to raise awareness. So we'll conclude the program here. I'm just going to turn it over to Sheikh Noor to please do a prayer for humanity, because our hearts, minds, and souls are with those who are victims of this and are suffering. Sheikh Noor, if you can please lead us in the dua.
Ahsantum, thank you so much, and thanks to our co-panelists once again. Our special du'as are with you, inshallah. Dr. Shaukat, Brother Ali, and Haji Najmu. You will, inshallah, be successful, and there is light at the end of the tunnel. By the grace of Allah, things are going to get better. And I once again urge humbly, my dear brothers and sisters, wherever you may be watching us, contribute whatever you can contribute. Reach out to Mainstay Foundation or the World Federation or any other organization who are trying their level best to reach out to those who are in need. By so doing, we will be helping out in a great deal. Let us all raise up our hands wherever we may be and sincerely ask our beloved merciful Creator to intervene on behalf of humanity, on behalf of the world. COVID-19 is a challenge without an iota of doubt. We pray that Allah Tabaraka wa Ta'ala makes it easy, in particular for our beloved brothers and sisters in India. Ya Allah, we ask you in this beautiful and holy month of Ramadan. It is a month that you host us. It is a month that you accept our amals and our du'as. We pray on this day, which is a big day during the holy month of Ramadan, that assist us and assist our brothers in India. Allah help them to be able to overcome this challenge. Let us recite the dua that we normally recite after each and every prayer in the holy month of Ramadan. It is a universal dua that we ask Allah. Bismillahir Rahmanir Rahim. Allahumma adkhil ala ahli al-qubur as-surur. Allahumma agni kulla faqir. Allahumma ashbi' kulla ja'i'. Allahumma aksu kulla 'uryan. Allahumma qdi dayna kulla madin. Allahumma farrij an kulli makrub. Allahumma farrij an kulli makrub. Allahumma farrij an kulli makrub. Allahumma rudda kulla gharib. Allahumma fukka kulla asir. اللهم أصلح كل فاسد من أمور المسلمين. اللهم اشف كل مريض. اللهم اشف كل مريض. اللهم اشف كل مريض. اللهم صد فقرنا بغناك. اللهم غير سوء حالنا بحسن حالك. اللهم غير سوء حالنا بحسن حالك. اللهم غير سوء حالنا بحسن حالك. اللهم اقض عنا الدين وأغننا من الفقر، إنك على كل شيء قدير. إن الله وملائكته يصلون على النبي يا أيها الذين آمنوا صلوا عليه وسلموا تسليما. اللهم صل على محمد وآل محمد. سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين.
Ahsan. Jazakallah, Shaykh Noor. May Allah bless you, inshallah. Thank you for joining us and blessing the gathering with your knowledge and wisdom and your guidance. And our respected panelists, Sid Najmi, Dr. Shaukat Mirza, as well as Brother Ali Prashaf. Thank you so much on behalf of our entire community globally for all that you do on the ground to help ease the pain and suffering of humanity. May Allah reward you abundantly for all your efforts, inshallah. And if there's anything that we can do, please do let us know so that we can coordinate with our network in order to help ease the pain and suffering of humanity. Thank you to all of our viewers for tuning in, for joining in, inshallah. And we hope that you realize that this is not where the work ends. The work just begins here. There's going to be months where people have difficulties with feeding their families, with supporting their families. This is just the starting point. There's a lot of work that needs to be done. We all need to come together. And inshallah we will. وآخر دعوانا أن الحمد لله رب العالمين.
Thank you.